Well, I was born in Liberia, and at an early age, maybe around about 10, 11 years old, I saw a lot of children dying, and I didn't know why. But then as I grew up and then started to figure out why, doing some research, and I understood that children were dying because of the poor system they had in Liberia with regards to childbirth.
Nobody wants to lose their baby. Nobody wants to say my baby died because there wasn't anybody there to help me.
But what hit me more was when my sister died from childbirth.
We did go there last May. We found out what the maternal health was like.
That so many people died, our kids especially died. And so it's just not from my family, but it's a widespread situation.
41% of women deliver without any kind of medical assistance at all.
Mothers don't know what to do with their babies. If the child born today, the next day they're giving them rice to eat, rice meal to eat. That's not healthy.
For example, when I went to Liberia last May, the nurses were asking me if I would assess this patient who'd been there for quite a few hours now. When I assessed her, I felt that the baby was not alive anyway. And that's just an example of one thing that I saw in Liberia.
My name is Konah and Dianne. I was born in Liberia, and I founded Icareformoms. Our main mission is to prevent infant and maternal mortality. Our first goal is to start off with a clinic in Liberia, and we have a place we started off with called Caldwell.
My name's Dianne Renaud. I've been in obstetrics now for the last 35 years. So our three pillars are basically birth support. So in our birth support, we want educated staff working in there. We want a clean environment. Then we have the medical interventions. So that would be part of it there. And the education is the most important part. So we want to educate staff and we want to educate our patients. Prior to pregnancy, if we get them when they're pregnant, then at least teach them about good nutrition and when to notify us that there's an issue.
Part of the process has already been done. So step one was to get the land, of which we have already purchased the land. And then step two, we're trying to see how we can get the foundation on foot. We have contractors in Liberia that would be willing to start off the project. If we have people here that would like to go to Liberia to help to build a clinic, we love that very much. We want to be grateful to those of the other people or volunteers who have donated some stuff to us, like the beds. And those supplies are already being shipped to Liberia and just waiting for the start foundation to move on. Well, we're hoping to have the clinic up and running by 2016. You can go on the website and it's Icareformoms. You can send e-transfer. You can also pay through PayPal. And we also need volunteers, people who can volunteer the time and idea to go to Liberia, and that would be really, really helpful to us.
I just want to bring a little taste of Canadian health to Liberia. We're not going to Africa or Liberia right now to change everything all at once. We're just going there to change it, as the Liberians would say, small, small. And if you're there to help us, we can accomplish that goal.